Welcome to this lecture on the basics of neuroscience. Today, we are going to explore a deeply complex and profoundly impactful topic, the pathogenesis of schizophrenia. This disorder affects about 1% of the global population, causing immense suffering. By understanding the exact biological and chemical mechanisms that go wrong in the brain, we can begin to see how modern medicine steps in to help. Let us dive in and build our understanding from the ground up. Before we dive into the molecular mechanisms, let us define what we are dealing with. Schizophrenia is a complex, chronic, and severe neurological and psychiatric disorder that fundamentally alters how a person thinks, feels, and behaves. It affects approximately 1% of the global population, causing immense suffering and lifelong disability. Clinically, it is characterized by three main categories of symptoms: positive symptoms, like hallucinations; negative symptoms, like emotional flatness; and cognitive symptoms, like disorganized thinking. Understanding the biological roots of these symptoms is the first step toward effective treatment. Now that we have defined the disorder clinically, let us try to understand what it actually feels like for the patient. Imagine sitting in a quiet room, trying to listen to one radio station, but suddenly, 3 others start blasting at maximum volume. You would feel completely overwhelmed and unable to separate reality from the noise. This is what a person with schizophrenia experiences daily. Their brain receives and amplifies too many signals at once. Instead of a smooth flow of thoughts, communication networks become tangled and hyperactive, leading to a terrifyingly distorted perception of reality. Now that we understand the clinical symptoms, let us look at the chemical imbalances driving them. For decades, the leading explanation has been the dopamine hypothesis. Dopamine is a crucial neurotransmitter that regulates reward, motivation, and the flow of sensory information. In a healthy brain, its levels are carefully controlled. However, in schizophrenia, this system breaks down in 2 distinct ways. There is far too much dopamine activity in the deep emotional centers of the brain, which causes terrifying hallucinations. Simultaneously, there is too little dopamine activity in the logical, decision-making areas, leading to a severe lack of motivation. This dual imbalance brings us to an important question. How do we treat it? To treat the overactive dopamine system, psychiatrists prescribe medications called antipsychotics. These drugs work by physically blocking the dopamine receptors so that the excess dopamine cannot bind to them. However, we must be incredibly precise with the dosage we give to the patient. If we block too few receptors, the terrifying hallucinations will not stop. But if we block too many, the patient will develop severe movement disorders, similar to Parkinson's disease. Finding this perfect balance is the core of mathematical pharmacology. To find that perfect balance we just discussed, pharmacologists use the receptor occupancy equation. This formula calculates the exact percentage of receptors blocked by a specific concentration of a drug. Y represents this percentage of occupied receptors. D is the concentration of the drug present in the brain tissue. Kd represents the dissociation constant, which is a measure of how strongly the drug binds to the receptor. A lower value means a tighter bind. The formula tells us that as the drug concentration increases, the receptor occupancy will also increase, eventually maxing out at 100%. Before we move on, let us see this formula in action with a concrete clinical example. A patient experiencing severe hallucinations is given haloperidol, resulting in a brain tissue concentration of 3.0 nanomolar. The dissociation constant for this drug is exactly 1.0 nanomolar. We need to calculate the receptor occupancy to see if it falls within the safe window of 65 to 80%. We substitute our values into the equation, giving us 3 divided by the sum of 1 and 3. This simplifies to 3/4, which multiplied by 100 gives exactly 75%. Because this falls perfectly inside the ideal window, the hallucinations will decrease without causing dangerous motor side effects. Now that we have seen a successful treatment, let us investigate what happens if the dose is too high. Imagine a different patient is given a much higher dose, resulting in a massive brain tissue concentration of 9.0 nanomolar. The dissociation constant remains exactly 1.0 because that is a fixed chemical property of the drug. Substituting these new values, our numerator is 9, and our denominator becomes 1 plus 9, which is 10. 9 divided by 10 multiplied by 100 gives a staggering 90% occupancy. This mathematical result physically explains why the patient suddenly develops severe muscle stiffness. The drug has paralyzed the dopamine pathways, and the doctor must immediately lower the dose. While the dopamine equations explain a lot about the positive symptoms, they do not explain everything. This brings us to the glutamate hypothesis. Glutamate is the primary excitatory neurotransmitter in the brain. It is the main switch that allows neurons to fire and communicate rapidly. In schizophrenia, there is a severe malfunction in a specific type of glutamate receptor called the NMDA receptor. These receptors become dangerously underactive. Understanding this secondary chemical failure is crucial because it drives the symptoms that dopamine medications simply cannot fix. So, what exactly happens when these NMDA receptors fail? When they are underactive, the brain's inhibitory systems fail to work properly. This leads to a chaotic surge of unregulated electrical activity. Think of it like driving a car where the brakes have suddenly failed. The engine just keeps revving, completely out of control. This unregulated electrical storm in the brain contributes heavily to both the severe cognitive decline and the negative symptoms of the disease, such as emotional flatness and memory loss, which are often the hardest parts of the disorder to live with. Beyond just the chemical imbalances of dopamine and glutamate, we must also look at the physical wiring of the brain. During normal adolescence, the brain acts like a careful gardener, trimming away weak or unused synaptic connections to make the remaining networks faster and more efficient. However, in patients with schizophrenia, a genetic mutation causes the brain's immune cells to become overly aggressive. They act like a gardener with a chainsaw, cutting away far too many healthy, necessary connections. This destructive process, called excessive synaptic pruning, physically prevents the brain from processing complex thoughts properly. To visualize the physical and chemical damage we just discussed, let us examine this diagram. On the top left, you see a healthy synapse with normal dopamine binding. On the top right, the schizophrenic synapse is flooded with excessive dopamine molecules, completely overwhelming the green D2 receptors on the postsynaptic terminal. Below that, look at the physical neurons. The healthy neuron on the left has abundant dendritic spines, but on the right, you can see microglia, the brain's immune cells, aggressively stripping away these spines, leaving the schizophrenic neuron severely pruned and structurally incapable of normal communication. We have covered a tremendous amount of ground today, so let us summarize our key takeaways. The pathogenesis of schizophrenia is a multi-layered breakdown of the brain's communication systems. It involves severe chemical imbalances, specifically the overactivity of dopamine and the dangerous underactivity of glutamate NMDA receptors. Furthermore, genetic vulnerabilities lead to excessive synaptic pruning, causing permanent structural damage to neural pathways. By utilizing mathematical models like the receptor occupancy equation, modern neuroscience allows us to carefully calculate drug dosages, helping to safely restore this delicate balance and bring hope to millions of patients.